Okay, this is our presentation on substance misuse, abuse, and addiction, the environmental and cultural factors. And our group is Mikkel, me, Emily, who's narrating, and Keelan. We all did this together. So health concerns, alcohol misuse, abuse, and addiction. They can have things like liver disease, mouth and esophageal cancers, accidents, complications from withdrawal, unsafe sexual behaviors, and poor self-care, and then mental illness as well. Illicit narcotic users, they have mental disorders including depression, suicide, harm to themselves and others, cardiovascular disease, and stomach issues, according to the National Institute on Drug Abuse. So they do have a lot of health concerns. It's really important that we keep them in check and make sure they get the help that they need. Cultural environment, when it comes to media, media will oftentimes decrease the severity and realness of drug and alcohol misuse, abuse, and addiction. In the Oceans movie series, it actually provides the idea that every special occasion needs to include toxic indulgence. So that is a negative influence there. On average, every 22 minutes shown on TV is someone drinking alcohol, but it lacks information on what alcohol misuse, abuse, and addiction can do to relationships and job security. It's very misleading. These inaccuracies place the population in a vulnerable spot, making consumers believe that alcohol and drugs leads to good times and problems that aren't brought along with them, which is just not true. This is all according to a study by Seabrook. Cultural environment, family support. Families often suffer right along with those who experience alcohol and drug misuse, abuse, and addiction. It's not just the person who is actually being addicted. Family support plays a big role with those suffering, and the family and individual can work together to recover. It's so important. In a recent study explained by this author, I can't say their last name, Adektok, having a healthy relationship between family and those recovering from addiction shows increased success rates of addiction treatment. So keeping them involved and informed is huge, especially because they are affected as well. Cultural environment, role of the peers. This is huge because they are just so influential as well. Just like the family, they play a big role to support those who suffer from alcohol and prescription drug misuse, abuse, and addiction. Man, try saying that 10 times fast. Having the right group of friends is absolutely essential for this population because it can lead them down the road to recovery. They can be so influential. They care what these people think. Having the wrong group of peers can make it way more difficult for this population to recover and may encourage the use of alcohol or prescription drugs. Often the reason these people are starting is because they are doing it with their friends, and it's something that they used to find a lot of joy in. And they used to have carefree nights. So they do have a huge influence on this population. Cyclic nature. Alcohol and prescription drugs users often experience recurring vulnerability, especially when addiction is involved. This addiction cycle includes the initial use, abuse, tolerance, dependence, addiction, and relapse. According to the American Addiction Centers, relapse rates for addiction rates are 40 to 60%, so quite high. Those who experience substance misuse, abuse, and addiction are often finding themselves in a cycle and recurring relapse, but the cycle can be broken if the correct treatment is available. So it's really important that we encourage that for these individuals. Legal and political system. Not only is substance abuse bad for you, your health, but it's also involved with many of those in the criminal justice system. It is argued whether substance use, misuse, and abuse is a genetic or biological issue, or if it's just a matter of personal choice, according to a study which was pretty interesting, Healthy People 2020. According to the Healthy People 2020, the federal government is beginning to implement health reform legislation, providing more services for mental illnesses and substance use disorders, including better access, coverage, and prevention services. They're doing a great job helping people with that. Potential barriers this population can encounter in the U.S. People who suffer from substance abuse are viewed by the public as more violent and dangerous. So that's a problem. There's kind of that stigma there. Americans also have reported that they are more likely to discriminate against people who suffer from substance abuse in housing, the formation of government policies, and employment. In the UK, people viewed these people who suffer from addiction as dangerous, unpredictable, hard to talk to, and having themselves to blame, which may be true, but that is a definite barrier for these people. These stigmas put those people who are addicted, who suffer from addiction, at greater risk for lower self-esteem, anxiety, depression, shame, failure to seek help, and problems with sleep patterns. They've kind of got it all stacked against them. This is all according to Burwell, a study by them. Cultural environment, international scope. So this was interesting. Large parts of Asia and Africa and South America do not have methadone available as pharmacotherapy from opioid detoxification, which is interesting because that is like the treatment for these people. It's life-saving. Russia actually has scarce resources for addiction rehab, even though the country has high rates of addiction and poor life expectancy for addicts. People who are suffering from drug abuse are required to be a part of a national registry in order to receive public health care for their addiction, and recovery centers are often more like jails around there. In developing regions like Africa, South America, the Middle East, and Southeast Asia, synthetic drug use is on the rise with few resources available to treat addiction. It's according to the recovery centers. Health disparities, socioeconomic status. Lower socioeconomic status is linked to increased alcohol, cigarette, and cocaine use among teenagers, which is so sad. Socioeconomic status can lead to health disparities like poor utilization, quality, and accessibility for substance abuse and mental health treatment. Socioeconomic status has also been shown to be influential in the progression from first use of a substance to dependence on a substance, which is huge. Racial differences in substance abuse are also closely correlated with socioeconomic status, with African Americans being more at risk for addiction with a lower socioeconomic status. Health disparities, race, and ethnicity. Caucasians reported higher rates of alcohol use than African Americans. African Americans actually reported higher rates of cocaine use, but Caucasians reported higher rates of use for all of the other substances. So, go American or Caucasians. African Americans seek treatment at much lower rates than Caucasians, most likely due to racial disparities in health insurance coverage, use of preventative care, and healthcare utilization. Substance use and abuse among minorities can be a coping mechanism to deal with environmental stressors like racism and discrimination. For religion, this is interesting. Religiosity as a whole, it was actually found to be protective with decreased rates of alcohol, cigarette, and marijuana use. Among Catholics, there was it was a greater incidence of reported alcohol use, but although alcohol is actually accepted and incorporated into the cultural practice of the religion, so that would make sense. And most of us know, but here locally, the LDS religion teaches strict avoidance of substances like alcohol, tobacco, drugs, except prescriptions, and caffeine. This can contribute to social stigmas and stereotyping toward those who suffer from addiction among largely LDS communities. The LDS Church does offer a 12-step addiction recovery program, though. Health disparities with gender. According to Wood and Elliott, men are much more likely than women to be addicted. They usually require more hospitalizations and have more detoxifications, and they're more likely to be addicted. Women are more likely to admit the need for help, and they do feel more accepted in society. So that's their differences there. Geographical location. It's actually interesting that in the more rural areas, it is increasing. Like in the big cities, there is a problem, but they have more resources. So in the more rural areas, like this Little Falls, Minnesota, I was reading about, they have this controlled substance care team that they're implementing there because there was such a problem. And with this, there's a social worker, a nurse, 2 physicians, and a pharmacist, and then anyone who checked in at St. Gabriel's Hospital who uses a controlled substance is required to work with that care team. And it went from being the top emergency visit at St. Gabriel's to being absent from the top 20 visit types. So less resources equals more use and higher instances. So it's important that we do things like focus on these places and implement things like that controlled substance care team to help with these little rural areas. The bias, unfortunately, is quite large with these populations. I had to put little reminders. Unconscious is the implicit bias, and then explicit is the intentional, uncontrollable bias that we have. Implicit bias was the terms addict, alcoholic, opioid addict, and substance abuser are used quite often. They're common terms, but they are, it's a form of bias and make these people uncomfortable. It's preferred that we use recurrence of use and pharmacotherapy instead. And then both medication-assisted recovery and long-term recovery are positive terms and can be used when applicable without promoting stigma. Explicitly, so ways that we can control it, Robin, which is reducing opioid bias is necessary. Implementation was a project that was developed and presented to 21 participants as a one-time 4-hour pre-test and post-test designed. It included a bunch of things like some short videos, films, writings, background, and it helped decrease this explicit bias with that program. So that was interesting. And then our last slide here, international scope. It is not just a problem in the U.S. It is prevalent in the U.S., but it is over 11 million people worldwide as of 2019 struggle with this, are addicted and actively either need help or are getting help. According to the Global Drug Survey in 2015, the United States was the highest, but United Kingdom was next at 1,199. This is just based on the numbers here. Actually, France was high. United States was next, United Kingdom, and then Australia, and then Germany that number is referring to these people who used at least one prescription opioid in the last year. Misuse and abuse by these prescribed opioid analgesics seem to be a problem that is not limited just to the United States and warrants attention on an international scale. And that is it. Here are all of our resources. 3 whole pages worth.